My name's Kat Mitchell. I'm a consultant anaesthetist. I work in Bath with Neil Bradbury, which involves doing anaesthesia for knee surgery. We work as a partnership, so I do the majority of his anaesthetics from your toes for about 4 hours. I look after the patients from the very start to the very end. Facing that way, it makes it much better for the patient. Because what you need to do is put the cheek gin underneath and then put a really good dollop of the expensive gin on the top so you get the taste. By having this teamwork, the patient's got fewer points of contact. They will meet Neil in the clinic. They'll then know that I'm going to be their anaesthetist. Before a patient comes in, I'll often pick up the phone and speak to the patient, and then they'll know it's me that they're going to meet on the day. And I think it's really important that the patient understands what's about to go ahead so that when you give them an anaesthetic, they know that you're doing it in their best interest for a good reason. Hello. Dr. Gatchell. I'm Kat Mitchell, consultant anaesthetist. I'll meet the patient about an hour before the theatre list starts. How are you doing?
I'm all right.
Yeah, good. So I'm just going to chat you through, and this is my first opportunity to really explain my anaesthetic. Is I make you numb from your tummy button to your toes, and it's a good opportunity for the patients to ask me any questions they have about the pain relief or about what's about to happen to them in the next few days. A lot of Neil's patients will have their anaesthetic done under spinal anaesthetic. It is the way of anaesthetising just the lower half of the body. It's not supposed to be a painful procedure. So I'm going to tickle your hips now just to find out where they are. And if you can just relax your neck down and relax your shoulders down. The patient will feel me just pressing in the small of their back, and I'll use a very fine needle to go in between the bony bits of their spine. I'll then leave a little bit of local anaesthetic into the spinal fluid and makes the patient numb from their tummy button down to their toes. So I'm just injecting the local anaesthetic in now. So you might start noticing your bottom starts getting warm. Okay, that's all done. Just taking the needle out now. The main advantages of having a spinal anaesthetic over a general anaesthetic is that it separates where the surgeon is operating from the rest of the body. So when Mr. Bradbury's doing his knee replacement, there's no stress response. During the surgery, I'm monitoring all the patient's bodily functions, so the heart rate, the blood pressure, temperature. The second bit of my role is to make sure the patient's comfortable and relaxed. With a lot of patients, the patients choose to have sedation so that they're fast asleep for the surgery. Some patients don't want to be asleep, and if they want to be awake, then my job is to keep them comfortable by talking to them or just allowing them to lie and relax if that's what they want to do. When the operation's finished, I'll take the patient down to recovery. I'll be in to see you probably about 9 or something like that. So this is a very fit and healthy lady. She's had a Mako total knee replacement. She's had spinal and sedation. I'll keep an eye on the patient there and make sure that the recovery nurses are happy with them. And if they have any problems, they'll be able to find me straight away.
So you know lots of information. Well,
So I really love this way of working. I think it's the best way of working. I feel like I'm able to do a really good job. And I really enjoy, if I meet a patient on the day of surgery, them saying, "Hi Kat, we spoke on the phone," or "We've met before." It just feels like a much more satisfying way of working.